very little about it in the public debate. An MQO poll, which was released last week, showed healthcare is the #1 priority of the people of this province, and registered nurses feel this way too. We've given each party 4 priorities which we feel should be on the agenda for this election. We're looking forward to hearing from each party and encourage our leaders. There will be a short Q&A section at the end, and we encourage you to ask your questions. We're videotaping this presentation so that you will...
Here this morning. Strengthening the healthcare system in our province has been a key priority for our government since we took office in 2003. Our government recognizes the pivotal role nurses play in the provision of high-quality services in our healthcare system. From public health to long-term care to hospital care, these well-educated, highly competent professionals are on the front lines of patient care and are working behind the scenes in management and administration to ensure the health and overall well-being of a full complement of nurses for our provincial healthcare system. One of the biggest impacts on recruitment, I believe, was the significant pay increases provided by our government.
I appreciate the opportunity to be here today. Good morning, folks. It's a pleasure. The healthcare system, Debbie Forward is right, it's the biggest issue in the province. Healthcare is the biggest issue. And I appreciate the opportunity to be here this morning to help address these issues. Because in a 3-week campaign, it's difficult to get a full exchange going. But this is a great opportunity to have that, and specifically dealing with nurses issues. Recruitment and retention is a specific issue that's identified here. One of the issues I think specifically that I've been made aware of is professional development, and I think that is something that we should address. We do it with teachers in the province, and I think that that is something that we should look at.
Able to meet with you and to hear your questions and hopefully give answers to those questions. With regard to this first question, I think the first thing I want to say is that we have made a commitment in our platform that we would do as a government a complete external review of our healthcare system, because we really believe there are major problems in the system itself. And the more I speak to people in the healthcare system, whether it's nurses or doctors or technicians, it doesn't matter what it is, I really do believe we have a mess systemically, and I think we do have to have an external review. We've made a commitment to that. With regard to the specific question, obviously the situation for nurses is part of the systemic issue that would have to be